If you had a magic wand and can change one thing about the revenue cycle ecosystem, what would it be?
Ease of access for our patients. And I know that's a pretty broad, but whether it's scheduling and that involves, automation and leveraging tools we have all the way through patient billing, right? You mentioned, high deductible plans for our patients, making sure our patients understand that, because they come back then to revenue cycle saying, what is this bill, right? And we have to explain to them, this is what you signed up for. So really, if I had my magic wand, making it easier and more transparent for our patients, I think that would create downstream impact to revenue cycle in terms of we could do better what we do.
If I could wave my magic wand, let's get together with the payers at the table and say, let's focus on what doesn't get paid. And let's figure out how we maybe fine tune the algorithms to get to that point. Because it's the amount of resources and time we spend to send medical records, to send documentation, to get a claim ultimately paid is a large cost. I know there's been articles written about that nationally, about a broken system. And I would agree. I think that's the case. And if I could wave my magic wand, it'd make us more efficient, get the cash in faster, patients would get their bills more quickly. It's a win-win for all of us if there's a way to make that happen.
I will say there is one for me. I would love to do away with co-insurance. I know it sounds very odd, but patients don't understand it. We have a hard time explaining it. I would love if we could just have a true copay only solution system, maybe deductible if you just had to have it. But I'd love to be able for a patient to go through the ED and say, this is exactly what your out-of-pocket is, and not be a co-insurance of an allowable amount that we don't know what that is until after the claim's been adjudicated. It's a complicated manner. So I think probably similar is to make ease of access for patients to understand their bill more easily. I think hospitals and healthcare systems, we kind of get to be the bad actors here because of charge masters, hard to explain, those type of things. But a lot of time it's just their insurance benefits, and we have to help explain that to patients. When we weren't at the table when insurance benefits were being discussed or planned out. So would love for that method to be better, more easily understood for all parties involved, so that we could make it an easier situation for our patients.
From a denials perspective, the biggest piece would be creating some technological interoperability between providers and payers in the space where we could share data more seamlessly. As I think about a lot of initial denials that ultimately get paid, it's oftentimes related to a lack of information or needed information from a payer that a provider has to provide to that payer. If we had better data interoperability, data integration, we'd allow payers to either self-serve specific pieces of information or not need that information in the first place because they have everything they need to process a claim cleanly. That, as I look at our biggest headaches, our biggest time sucks from our team, it's that provision of information that theoretically could be sourced elsewhere. So that's maybe my magic wand moment is we don't need to deny claims, or payers don't need to deny claims for lack of information because they've got all the information they need.